And we invited Catherine and Lisbeth to talk about their work on identifying single-use products that are used very commonly in healthcare, and maybe looking at some reusable alternatives. And yes, I give the floor to the two of you.
Okay, good afternoon. First of all, thank you for having us here so that we can present our study. We did an exploratory study on driving the shift towards sustainability in medical items used in hospitals. So we are both working, Lisbeth and I, at a university hospital in Ghent, in Belgium. And we did this study for the Federal Public Service for Health from Belgium. So they commissioned the study. Okay, here you have on the slide an overview of our study. We started with an exploration of literature. Then we did a hospital survey on single-use items with a high consumption rate and with a high cost. Following, we selected 5 medical items and we analyzed them for sustainability, for cost, efficiency, and safety. And for sustainability, for one item, we did an LCA, a life cycle assessment, and the other items, we studied the greenhouse gas emissions of the raw materials, because it's an extensive work to do an LCA, so we focused on one item for that. And the end of our study were recommendations for hospitals, for government, and for further research. When Healthcare Without Harm asked us to present, they asked to focus on medical textiles. So we have one item that focuses on medical textiles, and we will, in this presentation, focus on that item. Okay, in the literature, we search in the Medline databases and Web of Science databases on studies, particularly LCAs, on medical textiles from 2010 until mid-22. We did a study. We focused on items with 2 LCAs, because otherwise, if you have one, it's more objective to have different studies on the same topic. We concluded in total 4 studies on surgical gowns, on isolation gowns, and on a coverall. So here you see the pictures of the textiles. We looked at studies who compared the reusable one and the single-use one. We made of the different studies evidence tables. So yeah, it's not visible, I think, but in our report you can see all the evidence tables with the content on the life cycle phases, but also we have evidence tables with the quality of the LCA, about the methodology that was used in each LCA. So in the evidence tables, we noted the greenhouse gas emissions, for instance, for all the stages, from raw materials to manufacturing to distribution to the use and the disposal or recycling for the single-use or the reusable items. So generally, we can conclude that all the studies demonstrated that reusable gowns or coveralls are more environmentally friendly than single-use equivalents. So for medical textiles, it's quite clear that a reusable item is better for the environment than a single-use one. For completely, I want to show the table with all the items we studied. So here in the red, you see it's about the gowns and the coveralls, but we studied also other items. And for the environment, you see that all the reusable, or most of the reusable items are more environmental friendly. For some items, for instance, for endoscopes, laryngoscopes, the studies are not unanimous. It's sometimes the single use or the reusable, but that depends also on the methodology of the study sometimes. And for studies that it was available, we studied also cost aspects. So, and reusables are mostly more cheaper than single-use ones. Okay, so I give the word to Lisbeth. We do a bit of a Muppet show, I think.
Yeah. To keep you awake. So the second part, after the literature review, we did a hospital survey to identify the most critical or the most relevant items and to look for some more sustainable or circular alternatives. So we asked all hospitals, all Belgian hospitals, to participate in the study and to provide data on costs, so on consumption and on costs. 12 hospitals were willing to share their data, especially on consumption, but less on costs. So the cost data were a big problem, and in the analysis we used, therefore, the catalog or the list prices. I don't know which term is, So from those 12 participating hospitals, we created a long list of all kind of items, all single-use items. We looked at the top 20 for each hospital, and then we put them all together, and we created a list of 78 items, and we had to come to 5 items because that was too much to research in 1 year. And we also categorize them using the process needed to reuse those items. So if a single item, a single-use item, when we look at an alternative and we want to reuse that alternative, which process do we need, such as sterilization or laundry? And for each process, we chose 1 item. So it could serve as an example for other items. These are the results of the consumptions, the amounts hospitals gave us. And what did we saw? We saw especially medication cups, but also cover caps for ears. That was one of the most spiking consumptions, and it surprised us. But indeed, a lot of cover caps for temperature measurement are used here in Belgium. But also the red ones are all items that can be replaced by textiles. For example, bibs, so that are slobbages. I don't know if there's another English word for it, but for children, but also it's an item that is a lot used for geriatric patients. Surgery gowns, incontinence pads, diapers, gowns. So there's a lot of possibility to replace single-use items by medical textiles, reusable medical textiles. So our results of our for the consumption, what do we see? We see a lot of cover caps and cost. We saw, for example, vessel sealers who spiked at cost per item. So the one in colors, that are the items that we took in our report that we researched further. We had the intention to, for those 5 items, to look for the most sustainable and the most feasible option or feasible alternative. So we looked at, we did one LCA, that was for the vaginal speculum, and then we also focused on what we found in the technical data sheets, literature, meetings with stakeholders, working visits, observation. We looked at sustainability costs, safety for patients and for the healthcare worker, and efficiency, as Catherine also told. So we focus today on textiles, and for that item we included a blanket, which is chosen especially for its volume. So some hospitals work with disposable blankets for their patients, and it creates a lot of volume in waste.
Okay, here if we look at the raw materials for blankets, for the single-use blanket, it's often composed from polypropylene and polyester that can be in different variations, 50-50, 25%, 75%. If we look at reusable blankets, it's composed of cotton or a combination of cotton and polyester. So if we look at the greenhouse gas emission of the raw materials, so for these items we looked at emissions from the raw materials, not from all the phases in the life cycle. We see that for a reusable blanket, it's 1/10 of that of a single-use blanket. So that's less. That gives less emissions, and it's based, for the reusable, it's based on 90 uses. So that's what the laundry says, a blanket or a reusable blanket can't used 90 times. So we calculated the individual use and the emissions. If we look at the other stages, we know that for a single-use blanket, the most emissions come from the manufacturing and from the disposal. If we look at the reusable blanket, the main emission come from the reuse, so the laundry. So the water, the chemicals, you needed to process to launder the blanket. If we look at the safety, so that's certainly in hospitals with patients, it must be safe for the patient to reuse, but we can conclude that both for infection prevention, that's from the perspective of the patients, as for the occupational safety, that's for the healthcare worker, that it's equally safe for them, if the laundry process is according to the standards that are needed. And yeah, another important item in healthcare are the costs. If we look at the costs, for a single-use blanket, it's mainly the purchase cost, but also the waste cost that needs to be taken in account. And for a reusable item, it's the reuse cost. So Lisbeth told that it was difficult to get the real costs from the hospitals, because they often can negotiate with companies their prices. So we focused on the list or the catalog prices, and then single-use items are more expensive, but I think if we look at the negotiated prices, that single-use items are often cheaper than the reusable ones. And then a last item we looked, it's the efficiency. For the efficiency, we looked at the availability, the ordering, the storage space, the handling, so what is needed after you use the blanket, and the time consumption. So if a hospital can decide to do the laundry in the hospital, but often it's outsourced. So if the laundry is outsourced, then it's equally efficient. But yeah, if you as a hospital do the laundry yourself, it's logic that then a reusable is less efficient. Okay. Yeah.
We just saw that we have 5 minutes left, so we go a little bit faster. You can find this in the report. We will give you the link afterwards. Maybe I can go to the results of the LCA very quickly. So we did a life cycle assessment with 4 types of vaginal specula. So the reusable specula who were sterilized in-house in the Ghent University Hospital and double packaged in a laminate sterilization bag. And we compared that to 3 types of single-use vaginal speculum, one normal, one light-weighted but sterilized with ethylene oxide, and one bio-based plastic. So what do you see? That's the 0 line. No, you don't see it. That's 0. Under the line, it's the benefits. Above the line, it's the burdens. So for the reusable, it's clearly that it's best. What has the biggest impact were the packaging materials, as well waste as the packaging on sich, and but not really the reuse phase. In Ghent University, we use renewable energy, and we use waste steam from a nearby incinerator, and we use that heat to in our sterilization process. So therefore, the reuse phase is really small. And then when you look at the other the disposables, you see that the waste, so end of life of speculum and also the raw materials have a major impact. But that's only for global warming. When you look at all midpoints, and based on those midpoints we also calculated 3 endpoints, you see that the bio-based plastics are not doing very well. So that's the third column. So red is not good and green is good. Yeah? So the bio-based was really not doing well in the total of the LCA results. You can also find an overview of all the results in our report, but maybe we can jump to the recommendations. That's maybe the most important part.
Okay. So for hospitals, it's important when they purchase medical devices, they should integrate sustainability criteria in their procurement process. And Healthcare Without Harm has already developed such a criteria, so that would be nice to integrate it in a hospital context to use it. Also important is to have a sustainability team in your hospital, because it's needed to have expertise when you buy medical items. So people from the purchase department are often not specialized in this topic or have no attention for it. They focus most on the costs prices. Also beware of greenwashing, as Lisbeth told in the LCA of the speculum. The bio-based, often bio-based, sounds like it's ecological, but when you saw the results, that's not always the case. So that's also important to be aware of. Reusable items should be encouraged to be included in the procurement, because often tenders are only for single-use items and not the reusables are not considered often. Okay. Also, when you implement in the hospital to encourage reuse of the medical items, you have to be aware to augment the capacity for cleaning, for disinfection, and for sterilization. That requires a good process to do that in the hospital. For sterilization, for instance, you can do it in-house if you have enough capacity, but there are also possibilities to outsource the sterilization of instruments. Also, there is more research needed. For instance, in our study, we discovered that a lot of single-use items are disinfected with disposable disinfection wipes, but that has also an impact. So we think that need to be studied to compare wipes, disinfection wipes, sprays with, for instance, a disinfector. So what is more sustainable? Also, hospitals should be encouraged to use renewable energy, to use waste or heat steam for their processes. Oei. Holiday. Yeah. I pushed the wrong button. Yeah. Sorry. Thank you. So hospitals should also be encouraged to introduce reusable textiles. So include that also in the procurement process. And there are already laundries who offers, so in Belgium they offer already reusable surgical caps, surgical gowns, reusable bibs, but in practice we don't see it often. So we need to stimulate that. And also the logistic process need to be set on a point. So yeah, and manufacturers, companies should be encouraged to develop reusable medical items. I think that's the key, and not do the single-use items, but change to reusable items. Yeah. Okay, so that was really in a nutshell our study, but the complete study is available in English on this website, so you can scan the QR code, and we would like to thank our co-authors of the report and the Federal Public Services for Health for let us do this interesting study. Thank you.
Thank you again. If you could stay a little bit on the stage for questions. Thank you so much for presenting this. And I was actually surprised because I have seen all kinds of maybe ridiculous or absurd single-use plastic items. And before, my most ridiculous used to be disposable curtains. But I think blankets are actually quite close to it, to being like, maybe it's a tie, because I think this really shows how it got really out of hand, healthcare's use, the use of single use in healthcare. It is too much, and single use blankets, that's crazy. I didn't know about them, so thank you for telling us. And again, it shows how, I don't know, how easy it is sometimes to go towards the single-use options, maybe for a little bit, and then you kind of stick with them, and then they just become the norm, and then it is so hard to bring the reusables back, because people will ask, yes, but can you prove the safety of reusable blankets, or something like that. So yes, thank you, okay. Maybe it would be nice to also hear from the others what other ridiculous single-use plastic items they have encountered. But I do see that we have a question, so maybe I will bring the mic to you.
Thank you. You talked about comparing the single-use versus multiple use on the purchase price. Did you also consider it in terms of a total cost of ownership cost? So not only the purchase price, but also the price of the whole procedure?
Yeah, we also included the purchase price, but also the cost of personnel that's needed to reuse something. And for sterilization, we also included the price of the whole process. So the materials, the machines that are needed. So we had, we also included that. But in our study, we saw that mostly the reusable are less costly, but as we told, because hospitals weren't angered to share their prices, we used catalog prices, which are much higher or a little bit higher than the real prices hospitals get. So that was a real difficulty in our, a limitation in our research. Yeah, I don't know if that's...
Thank you. Yeah.
Okay.
Are there other questions? And I do encourage the people who have not asked any question today to also ask. I mean, also others, that's also fine. I mean, I do love it when there are some people that always ask questions, and I think it's amazing. So thank you so much to all of you who do that.
So you compare the single and usable blankets, and you also compare safety of these two blankets. How did you measure the safety for patients? Did you cultivate some bacteria, or did you take different types of patients? I'm just wondering how this research was done.
We compared the processes that are needed. So we looked at two things, so for the patient and for the healthcare worker. Now, for laundry, there is a process in Belgium, and there are some guidelines. Most of the laundry is outsourced in Belgian hospitals, and they need to provide microbiology tests. Yeah, sorry. And they have to do it several times a year and provide it to the hospitals there. So we know it's gereglementeerd. It's, their standards, their minimal standards in Belgium. So we compared that. Maybe you can add something?
Yeah, we did no tests, but we looked at the processes if they are safe for the patients and what the risks are. Yeah.
Thank you. And I also wanted to ask you, actually, because I did ask you to have this focus on textiles, because we see that it is a very high volume item where also reusable alternatives exist. But what other items did you identify as kind of like key items in terms of amount being used and with reusable alternatives available or maybe easier to implement?
Yep. We looked also at kidney trays. So I think the non-critical items that are used in hospitals, and non-critical in the sense of the Spalding classification on non-critical that only come in contact with the skin of a patient, that are easy options to, and also safe options to change to reusable ones. Thus, I think that there we can make a gain for the environment.
Yeah, yeah, maybe also some textiles, such as those gowns and bibs, and so we wanted to. We hope we can start some projects with that, and maybe scissors. It's often disposable here in Belgium. I don't know if it's also in other countries the case, but in Belgium, a lot of wound care material is just disposable. Scissors, kochers, yeah, such a thing. So also that is it's a major possibility.
Thank you. I'm also surprised when I see the single-use scissors, both when they are made of plastic or metal, which is even, in a way, it's even more painful to watch. But the metal ones can at least be recycled better, I guess. Are there other questions from the audience? Yes? I'm just looking a little bit if there's someone new, but if there's nobody, then don't be shy.
Yeah, thank you. Yeah, I was just wondering, because you look now at solutions to sort of procure greener, right? So to to change with sustainable options. But I was wondering if you also looked at, because you mapped out the LCA, if you looked at options that are greener in terms of reducing transport. So, for instance, procuring more locally, or instead of in-flight road consumables that are coming in through the road instead of flying in, like these kind of solutions.
No, we didn't. It was a one-year project which was commissioned by the Federal Public Service. So they determined the focus. But in our study, for example, on the LCA, we did not see a large impact of the distribution. For example, one of the specula was coming from Poland compared to others coming from the Netherlands, and that wasn't a big weight. So we have the separate item, the separate parts that for global warming, how much it weighs, but distribution wasn't one of the parts that really spiked. Yeah.
Yeah, the main components are the raw materials and the disposal of the single-use items. They give the biggest emissions.
Thank you. I'm just doing a last check if there are questions, especially from new people who have never talked before today. But if not, then I want to thank the both of you for joining us today. And by the way, they will also be there tomorrow at the Climate Summit, so don't miss them out. Thank you.